When I had graduated from chiropractic school, I lived in Illinois, and I planned on staying there until I got homesick of West Virginia pretty much. I love it here, so I wanted to move back. And I came to Morgantown. I'm from Wheeling, but I came to Morgantown and worked here a couple years, and then I opened Advantage Health and Wellness in 2005 on Mile Ground Road. And for 5 years we practiced there, and it was doing very well, so we thought we would try to get a little more into the middle of town and more visibility, and we ended up in this building. And since then we've become, I think, much more visible and more recognized by our community, and that has helped us to grow. I think what has made us unique is that we do combine a chiropractic approach with a physical therapy approach, and we use a lot of manual therapy. A lot of people will go to a massage therapist and get that type of treatment, and then they'll try chiropractic later, and then maybe they'll end up in a physical therapy place. A dozen years of literature says put those things together, you get better results, and that's hard to coordinate, but that's what we do here. We wanted to be easy to get to, so we put ourselves right in the middle of town here in Suncrest at the corner of Burroughs and Voorhis. One of the things that I think we do exceptionally well is handle the spine, which is either conventionally a medical approach, go ahead and numb that pain down, or it's time for surgery, let's go cut you open. But that leaves this huge middle ground of you don't like medicine, or you don't respond to medicine, and you're not ready for a surgery, or maybe you don't want to wait for a surgery to try to fix it, and that's where we fall. And we range from being able to do manual therapy that loosens up muscle spasm to one of the great things about it is traction and bracing to help to heal a disc that is damaged. You don't find that in most conventional therapies, but we've even partnered with medical providers to help get pain down quickly so that our rehab is less sore and painful while it's happening, and it can be more effective faster. So we've taken that whole big broad range that is usually left very blank, try some medicine and a little bit of therapy and then go get surgery. We've taken that big open space and we've filled it with stuff that actually fixes the disc. And if we can't help, I tell patients, if you give me the time I need to try to fix this thing and you do what I ask you to do and we aren't better, you can rest assured you've tried everything you could before going into a surgical consultation. We're using chiropractic and physical therapy and manual. We're using all of these modalities to help get people better, but because it's such a broad scope of knowledge, it's not just about spine pain or neck pain or back pain. We can treat shoulders, knees, ankle injuries. We can handle anywhere that hurts on your body pretty much. As far as chiropractic specifically, I do encourage people to read a little bit more. Talk to your medical doctors. 50 years ago they would have said no, never go see a chiropractor, but there's been a lot of information disseminated from since then that they do understand that we do have a niche, and I define our niche as primary care for spine problems for a chiropractor. And I think that it is most prudent for our community to know to go to a good chiropractor. There are good ones and there are bad ones. This is important to know. But go to a good chiropractor and treat them as their primary care doctor for these kind of spinal musculoskeletal problems. You know, I built a business model that hopefully does not rely on me. So I would love to see this practice specifically, but this practice model not just live another 10 or 20, but thrive 50 years from now. I think it is the way that healthcare should be handled.